It's Wendy Bowen here with Know Your Body Better. One of the questions that keeps coming up when I do shockwave therapy versus IMS with clients is, how did I develop this scar tissue or problem? So I wanted to go through the three ways that injury or tissue damage can occur in the body. The first one is trauma. Have you had a fall off your bike? Did you fall and sprain your ankle? Were you in a car accident? Fall from the trees, monkey bars? A number of things can happen to the body. Slip and a fall. You land hard on your buttock. A lot of times in sports, these may be big traumas that you know you've injured something, or they might just be little traumas that build up over time, such as the case of my hockey days, where you get hit and you fall down and you get back up, shake it off, and keep going. So you have a number of little of those, but the tissue can only take so much, so you may get a little bit of scar tissue in there. The little traumas are the ones that where we haven't really felt like we've hurt ourselves, haven't really taken care of. So when we don't take care of them, they build up over time. You may have had a deep bruise and it's scarred down, so that's tight in there. The second way that you're going to damage the tissue is what we call repetitive strain. So that's doing something over and over and over and over again, which is taking the tissue to the point of strain, but you're not giving it enough time to recover. And the example I like to use this is just take a tree branch and just, even if it's a nice clean one, a fresh one, and just bend it back and forth, back and forth, back and forth, back and forth. It doesn't break away right away, but it will eventually break down and break. The third way is postural strain. So if you're sitting or standing like this, you get long muscles here, short muscles here. So these are under strain. The muscles in your back are under strain. So with repetitive strain, the muscle gets stretched, or the tissues get stretched until they can't take it anymore. They'll give you a little pain signal and tell you to change position. But if you don't, and you do that over and over again, then the tissue will get damaged. So you're going to build up small cumulative injuries over time. And that will give you the sense of pain. And usually, I like the term, the straw that breaks the camel's back. So with those types of injuries, you may feel fine, and one day you bend over or bend the wrong way and boom, you've got the injury. They're not going to recover boom like that because they took time to build up. It's going to take time to reverse them. So these types of injuries won't go away on their own. You're going to have to do some work, come get some work done to you, but do your homework as well. So those are the three ways: trauma, repetitive strain, postural strain, that you're going to create tissue damage in your body. So it's Wendy Bowen with Know Your Body Better.